Welcome to the Deflux for VUR YouTube channel. I'm Carrie Redd, Training and Education Lead for Palate Life Sciences. Today, we're joined by my friend, Hal Scherz. So Dr. Scherz, how will a caregiver know or suspect that their child has a UTI?
Well, Carrie, the age of the child will determine very often what the symptoms might be and the location of the infection as well. In older children who have bladder infections, they will have the typical signs or symptoms that many adults are familiar with urinary tract infections. They'll have urinary urgency or urinary frequency, painful urination, sometimes blood in the urine. Those are very common symptoms of cystitis, and children who are older can verbalize those symptoms. In younger children, in babies or young children who can't really do a good job of explaining symptoms to their parents, they may have other signs. A child who was previously toilet trained may suddenly start wetting their pants or their bed. Many parents will discover that the urine smells badly, although that is not a reliable sign of a urinary tract infection, but certainly it's something that we'll see in many children with bladder infections. Kidney infections, on the other hand, are urinary tract infections that typically are associated with fevers, high fevers. And in older children who have kidney infections, they'll have a fever. They'll also often have the typical findings of urinary tract infection that affects the bladder. They'll complain about back pain. They'll have those symptoms that, again, point to this being a problem with their kidneys. In babies, you have to have a much higher index of suspicion, a lower threshold for looking for an infection, because babies very often have fevers and no other findings associated with it. Of course, if they have a runny nose or cough, or other people in the house are sick, that might explain why they've got a fever. But if there's a baby or young child with a fever of unknown origin, no reason to explain it, that needs to certainly be considered a possible episode of a kidney infection causing that. And then in the very young babies, the infants or the neonates, they can have symptoms that have nothing to do on first glimpse with a urinary tract problem. They can have jaundice, they can have vomiting, they can have failure to thrive. They just don't look good. So parents have to have a very high index of suspicion when their child is not looking good, or if they complain of specific urinary tract problems, that there is a urinary tract infection.
Well, Hal, it sounds like you're saying that if a caregiver suspects their child has a urinary tract infection, then perhaps they should take that child to see their primary care provider.
That's exactly what I'm saying, Carrie, because just as I've said, you have to have a high index of suspicion. When a child presents with some of these findings, it does not necessarily mean the child has a urinary tract infection. So part of the evaluation for a child who suddenly has symptoms that we've just described, that would require that the primary care doctor obtains a reliable urine specimen so that the diagnosis can be determined, because not all of these symptoms mean urinary tract infections. It's important to exclude an infection when those symptoms are present. And if it can be excluded, then other diagnoses need to be entertained.
Well, great. Well, Dr. Scherz, thank you for giving us this valuable information.